Okay, so in this video, I'm going to give you a bird's eye view of the autonomic nervous system. It's vitally important to the function of your health and overall well-being. And just in short, the autonomic nervous system is that unconscious nervous system that controls all physiological functions or processes in the body, like respiration. Here go our lungs. We're going to just take these off as we talk about this here. Lungs, okay. Heart, and that's your cardiovascular system. Stomach, underneath this liver. I'm just going to take this off. Okay, stomach. And you know, when you're fasting, it's important for you to be able to break the fast properly, because you have to stimulate the acid productions down here because they've been asleep for a while you're fasting. But your body has a normal way of, through the autonomic nervous system, of letting you know this, there's signaling. So that's digestion. We did respiration, cardiovascular through the heart, endocrine. We're going to use the pancreas here. This is an example of what the pancreas looks like. The pancreas has a dual function. It has exocrine function and endocrine function. And we know that the exocrine function is what secrete the digestive enzymes. And the endocrine portion is that portion that when the sugar is low, you're going to secrete glucagon to help bring the sugar back up to a normal level. And when it's elevated, you're going to secrete insulin to bring it down. So endocrine, and then our immune. And we'll use the colon as an example of where your immune cells and system is. It's about 80% of the immune system is here. Okay, so we're going to start putting some of this stuff back. But I want you to get an idea as to these organs here and the importance of having this system work in your body and what it does. And it does this unconscious. Let me move this to the side here and just kind of talk a little bit to you. So it does this unconscious. You're not really aware. You don't tell your salivary glands, okay, I've eaten some starch or consumed some starch, potatoes, now secrete some amylase to digest it. So that's what happens. But the most important thing that I want you to get out of this is the fact that there's two parts to the autonomic nervous system: the sympathetic portion and the parasympathetic. Your sympathetic portion is that portion of the autonomic nervous system that responds to stressful situations. So, you're going to secrete your stress hormones. You're going to do that in order for you to respond properly. The parasympathetic is a portion of the autonomic nervous system that responds to rest and digest. So that's generally working when you're asleep or when you're in a relaxed state. And you can always tell which portion is working based on your demeanor. Sitting. For a person who's 70, 80, or 90 years of age, sitting to try to go from a sitting position to a standing position is a very difficult thing. And they might be totally relaxed or rather in a recumbent position, or maybe just, let's say, a sitting position. They have to stand up. They're going from a parasympathetic position, rest and relaxation, to a sympathetic position, because now the brain has got to stimulate just with the thoughts. It's got to stimulate the circulation to get the proper blood flow to the muscles. And then the nervous system it's got to be able to prepare the muscles that cause the body to stand. That's the muscles of extension. Relax the flexors, stimulate the extension muscles. That could be quite a daunting task for a person who is of age, because basically for them to go from a sitting position to a standing position, they've got to recruit muscles, increase the circulation. So it's a stressful situation. So now they're going from a parasympathetic position to a sympathetic position. You also have gravity. Gravity is keeping them down or pushing them down. And a young person, they override that. As you get older, you'll see that gravity plays a big role in this. So you got to recruit some higher brain thoughts. So what controls the sympathetic nervous system? What controls the parasympathetic nervous system? Well, I'm just going to see if I can find this little, we do have part of our brain here that's cut away. Okay. And it's a part in here called the hypothalamus. Let's see if I got a little pointer here. The hypothalamus, this is part right here. Okay, so this is the brainstem coming up here, cerebellum, And this part right in here, you don't really have to know this, but I just want to show you that a lot of what you do in terms of motion and relaxation come from right here in this organ right here called the hypothalamus, below the thalamus. And there's a front part and a posterior part. So the anterior part, or the front part, controls your parasympathetic, and your posterior portion of this hypothalamus controls the sympathetic. So what you want to do is you want to be able to utilize that. So you have to have good brain function to do that. And the brain, we know the brain uses about 25% of all your energy. That's your glucose. A lot of your oxygen uses 25% of the total oxygen that the body utilizes. So that's very important. And what I really wanted to talk about was your diet, the influence of nutrition on this, because your nutrition is so important. And you'll see that the majority of people during these holidays did not eat food that was agreeable to their body and it did anything for them. They actually ate dead food. Okay, you cooked all the enzymes, because the enzymes is the key of life. You need enzymes in order for you to process this food. And that slows down your autonomic nervous system to a point where it's not functioning properly like it should function to do some of your either activities of rest, to slow it down, or activities of movement, speed things up. So this is something that we have to get straight, because we found, and I've done this for 42 years with our patients, that most of our patients were basically sympathetic dominant, meaning that they need to have a vegetarian type diet. So that means a lot of magnesium, potassium, not so much calcium. As a matter of fact, American patients who look like me, I rarely ever recommend calcium for them, because they can get a lot of calcium from their vegetables, more than they need. I've rarely ever seen patients who are more parasympathetic dominant than sympathetic dominant. So if you're sympathetic dominant, you need more of a vegetarian type diet, not a lot of meat. So we got a couple types of people. We got people who are sympathetic dominant. We need to tone that down, bring up the parasympathetics. We got patients who are parasympathetic dominant. We need to tone that down, and they usually require more meat and they require more calcium. See, that's rare. Americans who look like me, like I say, are basically sympathetic dominant, or the ones who are healthy are balanced. We got that one that's in between, that's in the middle. They are balanced sympathetic-wise, and they're balanced parasympathetic-wise. But there are conditions when the sympathetic nervous system and parasympathetic nervous system, even though it's balanced, is not working properly. They have more of your colds and flus and chronic illnesses that relate to fatigue, chronic fatigue syndrome, fibromyalgia, these kind of illnesses. See, and it's really easy to balance those patients, because they can go either way. They can eat some meat sometimes, usually seasonal. They can basically do a vegetarian type diet most of the time. They rarely ever need calcium, although when they decide they want to eat some meat, we do have them take a little calcium. But most of the patients need magnesium and potassium. That's where you see the majority of our patients. And these are the patients who have blood pressure issues. They have blood sugar issues. They may have certain cancers of the large organs, breast cancer, colon cancer, liver cancer, lung cancer. They have those type of cancers. Okay, and so to balance these patients out, we've got to make sure that this patient has less taxing food on their digestive system. Make sure they have a lot of magnesium, a lot of potassium that's balanced in the body. They don't need a lot of B12. The patients who need B12 are the ones who are parasympathetic dominant. We're trying to tone that down, and they have to have meat in their diet, red meat. And it's important to get the meat in places that don't inject the meat prior to selling it to you. So we recommend farm-raised meat. You need to start traveling to the farms. If you can't raise it yourself, go to a farm and see how they raise the cattle. And then that's the type of meat that you should eat. Now, another thing, we know this high protein diet with meat is very taxing on your kidneys and your liver. So we have to have these patients keep their colon clean, make sure they have probiotics in the diet, the right bacteria. Calcium usually absorbs well with these patients, but we do have to have them periodically take colon cleansers, enemas, colon hydrotherapy to make sure that they don't get a backup in the colon and a backup with their protein. But now the patients who are sympathetic dominant, they also have to have colon care. See, because they're breaking down a lot more toxins than you can begin to imagine. So now how does this relate to the holidays? Well, most people did not consume a vegetarian type diet. They had all sorts of meats. They had cooked foods. Most of the food was cooked. Did they have salads? Very few. Okay. A lot of sugar, unnecessary use of sugar in cakes, pastries, cakes, pies, and you name it. The worst food that you can eat is a starch, mac and cheese. You talk about artificial food. It's not even considered a food in my perspective. So during the holidays, even some of our patients we've taken care of for years, they ate dead food. See, and so this is going to show up in a week or two in the form of constipation, maybe an infection, depending on the type of meat that they ate. Turkey might not have been very clean. They're going to have diarrhea, alternating constipation and diarrhea. So that's why I say that your diet is influenced by the autonomic nervous system, but the reverse is also true. The autonomic nervous system is influenced by the type of foods that you eat. The less natural, the less wholesome, the less real the food is, you will have a dysfunctional autonomic nervous system. And when this autonomic nervous system becomes dysfunctional, that's how rogue cells can show up, because these cells are in starvation mode. You feel full, but your body, the core of your body, is actually starving. Now, what do doctors like myself, chiropractors and naturopaths, some osteopaths do? We make sure that you have the integrity of the nervous system by focusing on one of the main nerves. And even though it's more parasympathetic than anything else, is the vagus nerve, the 10th cranial nerve. We make sure that the spine is properly aligned. That's very important, because you're going to find out that sometimes it's diagnostic for the doctor to see a certain vertebrae out of alignment constantly. You know, if it's out of alignment constantly, like C7 or T7, rather, thoracic vertebrae number 7, in that area number 6, I'm going to be looking toward your pancreas. They have blood sugar issues. Okay. So that's very important. So the integrity of the spine is key. It can be an indicator of certain dysfunction in the autonomic nervous system, but it can also lead the doctor to know that this patient has some sort of dietary insufficiency that affects this area, or maybe it affects the entire autonomic nervous system, either sympathetic or parasympathetic vertebrae. So, or parasympathetic nervous system. So it's important that you keep your diet at the forefront, because this is important in old age. A lot of the problems that people have with senility, children with alertness, is all due to diet. And the chemical poisoning of food is showing up in the spine in the form of subluxations, which is any alteration of the normal dynamics of articular structures. So what I just said, the bones rotate out of place, they're crooked. They may cause swelling of the disc. The disc may touch the nerve, as you see with the sciatic nerve. And the sciatic nerve, we know, is whatever your thumb size is, that's the size of your sciatic nerve. We learned that on dissection. But it's a huge nerve. And when it becomes inflamed, you will have problems in your lower back, or you have problems in your leg, you have problems in your legs, thighs, the cup underneath the heel. Sometimes about 25% of the population, there's a muscle in the buttocks that this nerve will penetrate. And so you may not have problems with the low back area, and you may not have problems with the thigh. But the problem is in the buttocks, with the sciatic nerve, because the sciatic nerve is being squeezed by the piriformis muscle. So I'm saying all that to say this, that it's important for you to monitor what you eat. And today, more importantly than ever, because the food companies, your grocery stores, are not what they were 60, 70 years ago. Okay, so profit is over and above care for you. And I've also noticed, and I'll finish with this last point, that patients, there's such a big, I want to say, there's such a big, and I'm at a loss of words as to the influence of insurance right now. We talk about insurance as though that's your health. The best insurance is good health. What I've noticed with our patients I've been working with servicing patients for 42 years. And what we've noticed is that the patients who did not have insurance up until the Affordable Care Act were the healthiest patients. They were more conscious about what they ate. They were conscious about their eliminations, conscious about their circulation through exercise, conscious about their rest. They knew that the body may have had deficiencies, so they wanted to make sure that they made up these deficiencies with the proper supplementation. Now, they didn't take a lot of supplements, but they did eat the best diet, the best of food. They did fast, see. And their autonomic nervous system basically was balanced. These are balanced people. They could have been vegetarian or meat eaters. They were right in the middle. Most were vegetarians. A few ate meat, but it was only during a seasonal period of time, and they went and got that meat from a farm like the Amish farms, or some of the farmers who did not inject the cattle with a lot of your chemicals and antibiotics. And so they were the healthiest patients. The patients who had insurance, these are the sickest patients. They have every test. Their files or charts were the size of law dictionaries, and they never get better. So insurance is not the issue. Good health is the issue. And it is your responsibility to be able to take care of yourself, not the doctors, not the nurses, not any of the medical staff. It's not their responsibility to take care of you. When you see them, you're in crisis mode, generally, because you're not taking good care of yourself throughout the year. That once a year visit with your primary care physician is not enough to take care of your body. So that's why we often work with our patients on a monthly basis, trying to revitalize the body, regenerate the body, get rid of the dead tissues through multiple forms of care. So a supplement by itself it's nothing more than expensive urine. That's all it is. Okay, you cannot change your body or change your health with one supplement or one type of supplement. And a supplement is just what it says it is. It supplements the actual food. If you don't have carrots in your diet, why are you taking vitamin A? There's nothing to stimulate the brain or stimulate the heart or stimulate the nervous system. I mean, you can take gotu kola for the brain. You can take peppermint. You can take rhodiola, ginseng for energy. But that's just like taking coffee, to get energy. So supplements are supposed to add to or enhance the actual food. So you're going to have to eventually come around and eat the proper foods that your body requires on a daily basis. Okay, so I hope that gives you some information as to why we put so much emphasis on the autonomic nervous system. It's like I say, the mind controls the brain controls the autonomic nervous system, and autonomic nervous system is controlled by the hypothalamus. And so you want to make sure that you have good brain care, good cervical care. This is why a lot of your doctors who manipulate the spine work with the cervical spine and the vagus nerve. That helps to keep that hypothalamus nerve-wise functioning properly. So I hope that gives you some information while we focus so much on the autonomic nervous system. And I'm going to talk more about nutrition and the importance of nutrition and the reason why 70% of the population has issues chronically, and most of these will be cured or taken care of by you, the patient. You have to now, because that's not something that medical or allopathic medicine actually handles. That's not their field. They deal with crises. Now, there are crises that actually occur with these chronic illnesses. They handle that. But still, it's your responsibility to make sure that you get into a rejuvenation program, a program that helps your body to help itself over a period of time. The older you are, the longer it takes, and the habits actually catch up with you as you age. Okay, best in health.